There's been a number of measures introduced nationally to help people living with diabetes offset the cost of insulin. But some people can still end up paying as much as $6,000 a year for their prescription. As Michael Germain reports, Wisconsin Democrats want to provide some cost relief with a new bill.
37 million Americans have diabetes. And sadly, up to 8 million are undiagnosed.
With the price of insulin on the rise, it's little wonder many folks here in Wisconsin struggle paying for their prescriptions.
As we know, the high cost of prescription drug places a substantial financial burden on all Wisconsin families. And one of those prescription drugs is insulin.
That's why State Representative Jill Billings and Senator Brad Pfaff made a stop in La Crosse today, introducing legislation that would cap the price of insulin at $35 for those who receive insurance through state-regulated health insurance plans, as well as through the individual market.
We need to make sure that individuals like my son Andrew and everyone else that have diabetes or diagnosed with diabetes, that they can fight this disease and that they have medication that is affordable.
The Inflation Reduction Act of 2022 put a $35 cap on insulin for people on Medicare over the age of 65. The Affordable Insulin Now Act would do the same for private group and individual insurance plans. But those measures don't cover everyone.
We know this is important in Wisconsin because an estimated 7.4% of Wisconsinites aged 18 and older are diagnosed with diabetes. These are important people in our lives. These are important people in our society.
For local nonprofit clinic St. Clair Health Mission, pharmaceutical costs are their largest expense.
They have to stay with us, even though they get much higher quality care at Gunderson or at Mayo, but they can't afford the $2,000, $3,000, even $1,000 in medications every year. So that's why we think this is such an important bill.
It's not a new idea. Wisconsin will be joining 22 other states that have also introduced legislation capping their insulin prices.
It's unclear, though, how this bill will fare in the state legislature.